Great. Hey, it's a pleasure and a privilege to chat with you guys, Mary. Thank you so much for getting us started. And so, yes, I am Chris Pike, and I'll take the moment to introduce myself. I'm going to talk to you about reentry, ideally a safe and confident reentry in the context of COVID. How do we get back to worship? How do we get our facilities running again? At the same time, I'll tell you, who am I and why am I talking to you? And then I'll dive in and tell you how the next half hour or so is going to go. And so, yes, I'm Chris Pike. I'm an environmental scientist by background and training. I've been working in the built environment for about 20 years. I've been working on all aspects of the built environment, whether it's master planning and communities and entitlement, all the way down to commissioning in the boiler room. So I can offer you that perspective. I have worked for the US EPA on issues of air and water pollution. I've worked for nonprofits a number of times, including right now, and I've worked for industry, including work on indoor environmental sensing technology. So I can bring that perspective to you during this conversation. So let me go to my first slide here. So I've divided my remarks into two parts, hopefully. Well, I definitely divided them into two parts, and hopefully this will work for you. The first part, I'm going to talk a little about the science of COVID in buildings, just a little bit, just to give us a common understanding about some of the things that, for me, feel the most relevant in thinking about how we design and manage our reentry strategy. So I just want to get us on the same page. It will in no way, shape, or form be exhaustive, but these are some of the things that I believe are particularly relevant to have in hand. The second part is I will talk to you about what we have been doing in terms of providing practical solutions for facility managers around the world and across the United States. And so we're going to divide this into two parts, and we're going to start with science, because we're going to start with developing a common understanding about COVID and the indoor environment. This starts with understanding where we are. And this isn't new, but our COVID crisis is clearly not going away yet, although we understand there are signs of hope in vaccine and in our therapeutics and in our personal protective equipment and procedures. It is as bad as it's ever been. And so clearly we have a lot of folks who are getting sick, and many folks, unfortunately, who are passing away each day, 3,000 to 4,000 people a day over the last couple of weeks. And so it remains a challenge even as we go into a recovery phase. So one of the things, and this is by far the most numbers and letters I will show you the whole time, but I want to make a very simple point. I'm not going to give you an eye test. I do want to say that people are exposed to COVID in a wide range of indoor environments, including where they learn and where they worship. And so on this table, the only thing I want you to know is that over the last year, science has done exhaustive studies to identify infection clusters in different types of built environments, whether it's a bar or a conference center or an aged care facility or a prison or a religious building or a sports complex. And so the things to take home from this are, one, people get infected in all sorts of indoor environments. It is a nexus for clusters of infections. At the same time, one of those clusters are religious facilities, but religious facilities are not unique in that way. So they are important, they are part of the challenge, but they are not unique. We share this challenge with essentially every other kind of built environment. So there is a good literature from all around the world, the US, Singapore, South Korea, China, India, Netherlands, Germany, documenting spread in the kinds of places that we manage. But those places are not alone, and it's certainly not even at the extreme. Okay, when people talk about the basics, why are we worried about spread in the places where we go to gather and to worship and to do these kinds of things? Maybe the preeminent milestone study was a study of a choir practice in Skagit County, Washington. This is pretty well known by now. This came out back in May, but I want to refresh you as to why was this study a landmark? What did it tell us? And why is it still relevant to what's going on? The way we might look at this kind of study is that these folks gathered to have choir practice in an indoor environment. And in this graph right here, you can see a number of days from when choir practice occurred, and then when what they call the index patient, the first patient, developed symptoms, and then there was another choir practice, and we saw this super spreader event where we had upwards of we first had 4, 6, 18 folks who were diagnosed with COVID, and this ultimately led up to 53 people coming down with COVID from this one event, right? So what we know that this very common practice that happened, so choir practice, indoor environment, and what was it about this that happened? And so as we have gone through the year, here's an article from August that tells us a little bit about why this was a super spreading event. So one of the things relates to what we do in the indoor environment and the precautions we take. If you look across here and you start to see what are the behaviors that might happen at choir practice or during a worship service or something like that, we can say, hey, these bars represent how many viral particles could someone be putting out there in the world. And of course, we know with COVID, that person may have no symptoms, they may not know they're affected, but what they are doing is releasing particles, releasing virus into the air. And as we go from simply sitting quietly breathing, a very minimal amount of output, to talking to someone over a close distance, to loudly talking, maybe giving a sermon, to singing in the way we might sing in a congregation, to singing loudly the way we might do in a choir, to singing at a high pitch, all of these things multiply the amount of virus we may be introducing into that environment. And it's critical to know, so the kinds of behaviors that happen in our indoor spaces are emitting different amounts of potentially contagious material into the air that other people can intercept. And there are things we can do about it, changing our behavior, spacing ourselves out, or, for instance, wearing a personal protective equipment like a mask. You can see how dramatically a mask reduces this output of potentially infectious material. So this is relevant to us because we know that the places we are managing are a potential locus for transmission. We have evidence that many people have encountered the virus in these settings, and the behaviors that we do in these spaces are relevant to transmission. And so just to give you a little more detail, I realize it's not all about the worship hall itself or not all about choir practice. We may be running a food service area or a classroom. And so let's think about how the things we manage, such as our ventilation, our air conditioning, might relate to the spread of virus in a room. And so here's a case study from China that was published back in July. And I'll give you a sense of a typical layout. This is a room, it was a restaurant with round tables, and an air conditioner was blowing from left to right across this setting. And what they were able to do was to track the spread of the virus literally across this restaurant in a table-to-table direction. And they were able to show that the flow of air from the air conditioners caused the transmission was associated with the transmission of the virus across the room. So definitely something we can manage in terms of where people are, how air is moving, and directly related to the chance of getting infected. And if you want to see a more interesting version of this, they have done exhaustive computer modeling and so forth to look at how the particles both are emitted from people who might be infectious and taken up by the recirculating air conditioning unit and propelled into the room. So beginning to visualize, where are we sharing air? The key issue is, where are we sharing air in these spaces? So from the point of view of being facility managers, one of the things I want to drive home, we all know that COVID is a bit scary. We all know, we have ample evidence that transmission occurs in the indoor environment. We know that there are multiple pathways, and we're increasingly aware that airborne transmission is one of the dominant pathways, particularly for super spreader type events. The critical issue is there are things as facility managers that we can do to reduce risk, often dramatically. And there are tools that we can use to begin to, if we want to, even quantify that risk reduction. So I want to offer this to you not as a call to quantify your risk, but as a way to think the things that we control as facility managers have a big impact on risk. And so what are some of those things? We can work to lower occupant density, to manage humidity, to manage outdoor air supply, and to provide higher grade filtration, and to focus on wearing personal protective equipment. And we can say, based on well-established disease transmission models that these things make a difference in risk. So we have models freely available, which I'll provide links to you and follow up as examples, where we can say, we can take a baseline design where we may have high density, low humidity, low outdoor air supply, low levels of filtration, say a MERV7 filter, and no mask compliance. When we change those conditions, we can see a factor of 90% drop when we go to low density, higher humidity, more outdoor air supply, higher filtration, and more mask compliance. So the things that we control as facility managers can have a significant difference in the infection risk. Those can be risks from one time when folks go in, or the risks that they may encounter day over day or week over week entering your facilities. So with that tiny bit of background, I want to talk to you about how we might structure this as facility managers. And I want to talk to you about the tools that we have at ARC. I want to tell you what ARC is as a set of tools for you guys. So first and foremost, I represent an organization called ARC. And what you should know about ARC today is that ARC is part of the U.S. Green Building Council and the GBCI family of organizations. So ARC is a little bitty operating unit where we focus on advancing USGBC's mission of market transformation, providing better places for people and the environment. We focus on helping people manage, measure, and score the performance of real-world operating spaces, buildings, and places. So we are the real-world measured performance people in the USGBC and GBCI universe. Our role is, yes, we are associated with LEED, and our scores, the data that we take in about spaces, buildings, and places, we turn it into scores to basically understand how well buildings are performing in energy, water, waste, transportation, and human experience. So we take in data from partners, people enter it manually, they send us spreadsheets, we connect to third parties, big ones and small ones, whether it's a Schneider Electric or something else, and then we give LEED scores that they in turn recognize with a plaque. So we are a provider of inputs to LEED. We also work with people who have no interest or no desire to certify to LEED. They just want to measure, track, and score their performance over time. And I'll talk to you more about that. So when it came to ReEntry, around about March, we started to hear from our users, obviously, as we were all kind of becoming immersed in this COVID response, that what we were doing with human experience, which for us, that means a combination of occupant satisfaction and measured indoor environmental quality, specifically carbon dioxide concentration and TVOC. And folks who have been working with us, they said, hey, this is part of what we need to know as we plan our re-entry from COVID-19. But we need more. We need more targeted tools. We need to take those tools, expand them, and target them to infection control. So during April and May, we developed with our partners and with the LEED volunteers a set of tools called ARC ReEntry. And that's what I'm going to talk to you about today, which it is our response to COVID. And the things I'm going to share with you are by and large immediately and freely available to you to deploy in your facilities. And so they are a part of ARC and a part of our mission to make real world performance measurement a ubiquitous part of green building practice. So I'm going to dive into what this is. My belief and our belief as ARC is that the way to manage for a safe and confident re-entry from COVID-19 is to think of this as an iterative management challenge. We are not talking about a certificate or a label or a stamp that says my building is safe. I think it's important to accept that that's not realistic. It is not possible to remove the risk that someone comes into your facility, sits down next to someone else, and that there's nothing you could do short of not allowing those people to interact that to stop that infection. However, there are things we can do to reduce risk. And the key here is that it's not a one-time thing. Reducing risk in the context of COVID requires iterative, systematic effort, day over day, week over week, month over month, until we get out of this thing. And so the challenge here is not to be good on a single day, like we're achieving LEED certification, but it is to put in place a management process that can reduce risk within your span of control for any given space that you're managing. And so what I'll talk to you about is essentially a 4-step program. It is first establishing leadership and accountability at whatever level or however your facility operates, putting someone in charge and providing some situational awareness for that person. To establish health-based plans and policies, I'll talk to you about that. Obviously, to take action on the ground, to verify those actions based on the experience of the people in your space, whoever that may be, I'll talk to you about that, to measure the indoor, to begin to think about measuring your indoor air, given how important airborne transmission is, and to look at your results and look for opportunities to improve over time, and to treat this as a cyclic process. You may be thinking about this week over week, certainly month over month, but trying to get better as our knowledge changes, as your opportunities change, and as the use of your facility changes. So we're going to turn this crank over time. And that's what our users are doing right now. So the other piece about this is everything I'm going to talk to you about with Arc ReEntry, we view as a gateway. So Arc ReEntry is, as you're going to see, a low or no cost solution that is available to everyone right now. We know that you may elect to go on to additional kinds of recognition like LEED or WELL or something like that, and that's great. We think what you're doing with us is a foundation for that journey. So we hopefully it's a starting point that's available to spaces and buildings across the country and around the world. So just to give you a sense of how does this actually work, so the thing I'm going to talk to you about as Arc ReEntry, it starts off being available for everybody. Everybody can create a project, whether that's a single space or an entire building, and then as a portfolio manager, you have the option to subscribe to an expanded set of tools and analytics, customer reports, and all sorts of fun stuff. But there's a path that everyone can do today. Okay. Over the next few minutes, I'd like to talk to you about 4 aspects of managing your facility for infection control that I think are available to essentially everybody who is on the front lines of facility management. We're going to dive in to that circular diagram, and we're going to talk about leadership, management, experience, and IAQ. The first one is leadership and accountability. And the bottom line message here is that managing COVID risk over time is a job. It's a responsibility. It's not a single checklist. It's not a single point in time. So the very first action is to give an empowered person specific control and authority over the infection control process. The buck has to stop with a person. And that's critical in that that person needs to be able to coordinate what we're going to see is a fairly large number of issues that need to come together with a point of accountability. And people need to know whom to contact if they have feedback or questions or uncertainty. That person, in our experience, is almost always backed up by a team, because this is rooted in multiple disciplines, whether it's the janitorial team or the folks who are maybe a contractor for the heating and cooling system or something else. There are multiple folks. That responsible individual is essentially the general contractor in this scenario, and there has to be some mechanism for accountability, because this is not like your average green building thing where you're thinking, hey, I just want recognition for being good today. The consequence of not being good with this is increasing the risk that people get sick. So trying to understand this is closer to a pilot's checklist, where every time you start the plane, you go through the checklist. And every time the surgeon goes into the operating room, you checklist, even though you know what to do, the risk of not doing it is high. Okay, so what are we talking about here? Responsible individual, authority and mandate to take action, resources for implementation. This does require resources in some way, shape, or form, accountability for outcomes, and a support from a team. Okay, that's what we're talking about. The first substantial element here is facility management policy. And so what we start off with ARC is giving folks a scaffolding, really a elaborate survey, to which they can bring together, to which we can recognize the fact that they create health-based infection control plans and policies. The thing that we cannot do with COVID is that every jurisdiction is in a slightly different place, every town or city or across the country, and they have different guidelines. So rather than being prescriptive, what we're trying to do is to say every facility should be able to create health-based guidelines with explicit relationships to the public health authorities relevant to them, whether it's CDC or OSHA or ASHRAE or BOMA or Los Angeles County or the DC government. Wherever you are, it should be possible to establish and clearly document what's your plan and how does it explicitly link to those public health authorities. In turn, even though things vary a lot, there are a set of lowest common denominators things that every facility manager should at least be able to rule in or out of their set of strategies. These include occupant communication and signage. So have you communicated clearly to your occupants how you expect them to behave in the space, whether it's social distancing or communicating what you're doing? Part of that confident reentry is telling them what you're doing, whether you are enhancing outdoor air supply, whether you have upgraded the filters, whether you've used air cleaners. Communicating that to the occupant is part of raising their confidence. The next one is cleaning and disinfection. So even though we are focused on airborne transmission, cleaning and disinfection matters. Fomite transmission on surfaces does matter. And so while we don't want to over clean, and that's one of our sensitivities now, we're injecting a lot of chemicals into these indoor environments, we do want to make sure we are doing thorough and regular cleaning with the types of products that the US EPA has told us are both safe and healthy green cleaning products that are effective at eliminating COVID. And fortunately now, 9-10 months into this, we have really good lists of products that are both safe and effective against COVID specifically. Personal protective equipment, whether that is masks, respirators, shields, or other kinds of devices, making sure that they are available and critically that is complied with. It's the single most important thing we can do. The next one is occupant screening. Obviously, if we use that to help reduce the density of infectious people coming into the space, and then we have these truly critical things. Obviously, the heart and soul of COVID transmission is breathing the same air. So we want to ensure that our ventilation systems are working, that our filtration systems are in place, both physically, like that we don't have bypass around our filters, and that we are upgrading our filters to the degree possible within our systems so that we are moving as much air, ideally fresh air, through our system as possible. We are looking at pinch points in our building, elevators and other confined spaces that may create hotspots where the ventilation system doesn't work. Maybe thinking about supplementing some of these with portable air cleaners and other devices to hit those hotspots. If your spaces have been inactive, worrying about water system operations, Legionella, other things like that. So these are some of the things that are lowest common denominators: signage, communication, cleaning, disinfection, PPE, air supply, hotspot detection and mitigation, and physical inspection of your air systems. Check, making sure that these things are bread and butter and I know that none of these are news for any of you facility managers, but the fact that you are looking at them from an infection control perspective and that you may be doing this much more frequently than you were a year ago is critical. The next one is occupant observations. So the premise for ARC reentry is that doing these things, having these plans, policies, and procedures is not enough. People your occupants, whomever they may be, need to perceive that you are doing these things. And so the true test of your management actions is that your occupants perceive them. Now, clearly, there are, and we'll talk about this in a second, there are important things which occupants can't perceive, but it is part of your challenge to get that feedback. The way we've worked with ARC is we have supported our users in targeting these surveys to the folks who are in their facilities. So we know that maybe it's only a skeleton crew. Maybe you have a few folks who are in the space, maybe a few teachers, maybe a few visitors, maybe a few of the staff. Whoever it is, targeting your observations so that they can become part of your team as a facility manager to know, is this working for them? So the way that we articulate that in ARC is we provide tools to target surveys to folks, and we ask folks about different segments of the building, whether it's a particular common space or the whole building, perhaps a subset of the space like a school or a daycare facility. And we ask people to self-report their groups. Are they visiting the space? Are they working in a specific area or something like that? And we always ask them about their overall satisfaction, but we go deeper on things that are aligned with your infection control policies. We ask, do you see signage where you expect it? Do you see screening where you expect it? Do you have access to disinfection products? And if so, if you don't, where is that so we can fix it? Social distancing, PPE compliance, very easy type of mechanics to be able to say, do I always see it? Do I never see it? Do I usually see it? The ability, things that people can do on their mobile phone. So pretty exciting. It's funny, I say that it's exciting. It's exciting because people have understood that this might in the past have been something that they never did or something they did once per year. But we are finding in working with big stadiums and educational facilities around the world that doing this on, say, a weekly basis has been both good for infection control and really a way to invigorate their facility management. So upping the time, maybe going to fewer people more often has been a big breakthrough. Okay. The third and the final pillar of infection control is definitely indoor air quality. So as we have been working with COVID over the last 9 or 10 months, every month it gets clearer and clearer, whether it's epidemiological studies of transmission, super spreader events, whether it's modeling studies of the flow of air through a space, like I showed you earlier in the restaurant example. One way or the other, it is very clear that the flow of air is critical. And so our role as the people who manage the flow of air is consequently critical. The best practical proxy we have for how we are managing air is often carbon dioxide concentration. So I think many of us know, right, we have a baseline amount of CO2 in the outside air, 400, 425. And as more and more people are breathing into a space, that CO2 level climbs. By the time we have hit, say, 600, 800, 1,000, that is a very good indicator that our fresh air ventilation is not keeping up with the respiration of folks. And it's an indicator that folks are rebreathing the same air. So critically, CO2 concentration is not by itself a measure of infection risk. Clearly, 2 people in a room who have no COVID and are not sick, they can rebreathe all they want. Yes, they will get headaches and all that kind of stuff, but they can rebreathe all they want. But CO2 is a proxy for when that is happening. So so we have an indicator that says we want to understand CO2 concentration in space. And we also want to challenge folks to maybe take those measurements in more places more frequently than they used to. Maybe in the old days, a year ago, it might have been sufficient to simply take an annual CO2 measurement or have a couple of things in your building control system for demand control ventilation. But it's very clear that real world spaces are very heterogeneous with regard to ventilation quality. So measuring more spaces more often so that you have a approaching real-time understanding of CO2, and you can understand where your risky places are, and you can understand which places may not be adequately ventilated. So number one thing is using CO2 where you can, when you can, as a proxy for the adequacy of ventilation. Then we have a second tier of things that matter: relative humidity, TVOC, and PM. And let me talk to you about why those are there. Because in this context, again, we're not looking for viruses directly, but we are looking at things that facility managers control that are associated with transmission. So relative humidity matters to how far the viral particles go and how likely they are to be infectious. So generally speaking, lower humidity is worse. It's a bit of a U-shaped relationship actually, but low humidity, wintertime humidities are more infectious. Higher humidities, viral particles don't travel as far, not as infectious, lower risk factors. So we want to keep an eye on humidity, particularly when it gets low. So for instance, there have been a number of cases of transmission through ice hockey, where folks are in a poorly ventilated space with low cold humidity conditions. That's a high transmissivity area. Then we have TVOC. TVOC has nothing. Total volatile organic compounds are something that many handheld sensors can measure, but it doesn't relate directly to infection. In fact, what it does have to do is our cleaning practices, our temptation to really use lots of potentially caustic cleaning agents. We look for TVOC to give us some feedback to say, are we allowing enough ventilation? Are we using green cleaning compounds so that we're not exposing ourselves to excessive pollutants in the indoor environment while we are trying to do extra cleaning? That's a thing. The third and final one is particulate matter. So again, many handheld sensors to help us understand particulate matter. Here, PM is at least a proxy for the level of filtration we're getting from our ventilation system. So we want to be able to increase our filtration, to take more of those particles out of the air, and particulate matter is one proxy for that, albeit imperfect proxy, but at least a practical proxy to help us reduce that particulate matter in the air. So in the case of ARC, we take each of these three ways. One, we want to know what fraction of your occupied time in the building are these variables in a good range. So we establish a range of good, and then we say, how many of the hours are you occupied, that you are occupied, are they good? I don't really care about the hours when you're not occupied. And I also want to know, of your floor area, what fraction are you measuring these things? Do you have a little bit of data or a lot of data? And what fraction of your hours are you measuring? So this is admittedly a challenge. It's a challenge almost for everybody, but it's good to have an idea of what best practice looks like. When it comes to understanding your air, if we were able to deliver low CO2, moderate to high relative humidity, low total organic compounds, and low PM, and we knew we were doing it for every hour that we were operating, and we knew that we had information from the majority of our occupied spaces, that would give us a clear, measured sign that we were doing the very best we could to reduce the risk of COVID transmission in our space. So the way we support this in ARC is we help our users, we give them a framework to understand this. So every user in ARC can go in and both collect the data that I've described. So they can survey their facility, plans, policies, and procedures, send out surveys to their occupants, and organize all the IAQ information I just described. And then they get a dashboard like this one. It says, from a score of 0 to 100, where 100 is you're doing everything we could think of and you're doing it perfectly and your occupants agree and you've measured it, that's 100, to nothing, you're not doing anything. We give you a very, very simple score that you can track, trend, and improve over time, and you can break that into scores for facility management, occupants, and air, depending on where you are in your journey. Everyone can do this for free today. It's a thing. And then advanced users may want to go in and say, hey, I want to do this for all of the buildings in my parish or all of them in my portfolio, and begin to see who has more or less comprehensive programs. And so that's what we have here. These are little histograms that say, hey, here is this project and here are others that I manage. So this is the best managed project in my portfolio. This one has superior facility management. It's been asking questions of its occupants, and it measures and has high quality air. These are just starting out with air. These are about halfway through facility management. You get the idea. So this view is a little more appropriate to a portfolio manager, someone who has responsibility for multiple facilities over time. And then we provide a set of communication tools. Up to now, everything I've shown you is private, but I think what we have struggled with over the past, I struggled to even say what time, 9 or 10 months, is that what people have wanted in terms of communication has varied. And so we have kind of evolved with our facility managers. In the beginning, folks really wanted a singular label that said, hey, my space is safe. and as I told you at the beginning, that's really not something that we feel is appropriate to offer. What we can say is you are tracking your space with ReEntry. You are taking reasonable steps with facility management, occupant experience, indoor air, and you're on your way toward better management. We can give that to you in a report. We can give it to you in a scorecard. And we've been thinking a lot with our users about how do they want to communicate that to their stakeholders, whether it is a management group or individual parishioners in their place. Everybody has a very different level of understanding. They have a very different desire. The one thing I'll tell you that is challenging, people want a sign on the door that says, when I go through this door, I'm safe. And that's probably the one thing we can't give them. But what we can do is we can be transparent that we are doing smart things to reduce their risk in this space. That is a claim we can make. And we can back that up with science, and we can be transparent about it. That may be manifest in a report, in a scorecard, in a box score, whatever the right answer is for your communication. So I think that is definitely a challenge of our moment. The thing we probably most want, we can't have, but there are a lot of other things that are quite meaningful that we can have. And so if you're the kind of facility that is maybe interested in LEED, I will just say a little bit that we are part of the LEED family, and folks who use the ReEntry process that I just told you about are eligible to receive a LEED pilot credit. And so that requires a certain level of achievement with regard to facility management, occupant experience, and indoor air quality, fairly modest levels of performance. And all you have to do is submit a ReEntry report. And actually, if you go for this LEED pilot credit, all of the subscription doodad, extra goodness in ARC is free and included in this pilot credit. So that's kind of cool. It's a cool bonus. So that's an extra thing. I will say that this maybe gets a little advanced for some folks, but I did want to say that we understand very well that we are not doing this alone. So I wanted to give you a sense of how we work with partners to do this. And my point here is actually not at all to pitch these partners to you, but to tell you how we work with others and invite you to say, if you are interested in working with others, we are looking for people who are on this road with us, who are fellow travelers. So we are working with organizations, for instance, that do sensor technology or apps to make it faster and easier to collect the kind of information that I've shown you. And so I'll give you two examples, one from indoor air and the other from occupant observations. So we've been working with this organization. They make these little handheld sensors. So one of the questions you may have is, measuring this air is tough. I don't really have the right stuff. The good news is this organization and many others are making low-cost, portable, often battery-powered sensors like these that you can deploy throughout your facility to measure all of the IAQ elements that I have talked to you about in ReEntry, and more: temperature, humidity, particulate matter, CO2, TVOC, all in a little box that is pre-programmed to work with ARC. So we connect the two things together, we stream the data, and you can see them connected in real time. The point I want to make to you is that we don't make sensors, but we know that there are low-cost sensors that you can deploy in spaces that will measure all the things I've talked to you about on the time and space scales that you need to understand your risks. So it is possible to get off-the-shelf technologies at modest costs that allow you to plug and play and meet your needs for indoor air quality measurement. Very similar, that we offer out-of-the-box ways to collect occupant experiences. So free included occupant surveys. We also work closely with folks who are making apps so that if folks prefer to work with a third party to send their questions via an app, maybe you have an existing app or something like that, we make it really easy for those partners to integrate our questions and then stream that data back onto our platform. So these are just two examples, but I want to, the tone I want to leave you with is we give you default tools to do this, but there is a growing ecosystem out there to help and support you or customize this to meet your specific circumstance, to which we are really happy to plug in. So let me kind of leave off by saying, where exactly how do you get started? If you are an individual facility manager and from our perspective, from my perspective, from an ARC perspective, how do you get started with your with managing COVID for a safe reentry? One is put someone in charge. That person doesn't necessarily need special skills on day one, but you do need to have a singular point of accountability, someone who knows that how all these things are coming together. So please don't jump over. Don't just jump into doing without being clear that it needs to be someone's job. And it has to be a job that that person can keep up with for weeks or months into the future. That's a challenge. Two, start by documenting health-based policies and procedures. What does health guidance mean? And kind of going through that list of the bare minimum, whether it's managing air, managing hygiene, managing occupant screening, go through the checklist and relate it to the circumstances in your jurisdiction. Two, don't forget to engage those occupants, even if it's only a few people. Getting that feedback to say, is it working for you? Are you seeing it? Amazing how often that doesn't happen. And the fourth one is beginning to get closer to measuring the air. This is by and large an airborne problem. And we know that ventilation rates were not set, were not developed, and for many historic facilities are not even intended to supply the kinds of air that we need to manage this virus. So understanding where your hotspots are, providing yourself with some data, and knowing if it's working is a way to be both effective and efficient. It can also tell you if you're doing too much, because we know that supplying a whole bunch of fresh air can be costly. So let's use technology to tell us if we're getting it right and to help us do it in a more cost-effective way. We can talk more about that. Everything I have told you, I have been talking at you for more than half an hour now, so I appreciate your attention. I know this is a lot. It could be new to you. Maybe it's old hat, but there's a lot more behind it. And so everything I've told you about is available to you in something called the ARC Guide to Reentry. So everything I've mentioned about leadership, facility management, occupant surveys, and measured IAQ is available in the ARC Guide to Reentry. It's a free download from our website. There's a whole page full of guides, and I hope you'll check it out. And if you have any questions, I'm certainly open to communicate with you. So next steps, and I'll just kind of round this out. If you take only a couple of things from my remarks, is one, there are tools you can use today for free to get started putting your facility on a path to a safe and confident reentry. In my view, that safe and confident reentry is a process, one that you are going to need to put in place and repeat diligently over time, and to get better and adapt as our knowledge changes. And so we're happy to support you in that. If you'd like to learn more, there is a whole set of resources, including articles, the guide, and some case studies for individual facilities on our website at that URL. And I'll be circulating these slides for you. So with that, I know that I've been talking at you, and I hope there's a chance to have some Q&A and some dialogue and to tune this to things that you really want to learn about. So Mary, let me pause right there and see if there are, if any questions have come in, or if people, I can encourage folks to ask some questions.
Thank you so much, Chris. That was a wonderful presentation and a lot of great information. I want to assure all of our attendees, I got a question about getting a copy of your presentation, Chris. So I want to assure everybody you are going to get a follow-up from Chris that will include the copy of his presentation today. It will include a link to the recording of this webinar and other good information. I'm sure he's going to give you links to their website so you can download stuff. You'll get all that information in a follow-up email. But right now, if you have any questions, oh, we got some compliments coming in the question box. A lot of people like the presentation, Chris. So that's really good. And but if you have any questions, now is the time to type them in. We are so happy you were able to join us today. I think this is just all that my people are talking about. I'm pretty sure a lot of them are going to have to pull out their job description and just add that they're the manager of this.
That's right. It's unfortunately
It's
it's
going to
other duties as
expand there.
assigned, and this
That's
is in that
right.
bucket. And Mary,
Get out
Mary, if
your
you can
job
see, if you folks
description.
can. That's right. And unfortunately, add this other one in here. But if folks, while folks are formulating a question, I will just make sure people know where to go. And of course, as you said, slides will come to you, follow-ups will come to you. But I mentioned the location of the guides. So this is our webpage right here. You can find all of the guides and more right here. In terms of this is the one I referenced, October 2020. So you can just download this PDF. If you prefer it in Spanish, it's available to you as well. And once you go into this system, the great part about this is when you're ready, or if you're ready, you can log in. And this actually, for those of you who've had any contact with USGBC or anything like that, this actually is your USGBC or Lead Online account. You can also create an account for free. And you can go right in here, and I'll just give you a quick glimpse about what that looks like in real time. So here's the environment you see, and you can see we kind of welcome you with a, hey, get started, select a project to get started. And what I'll do is I'll pop in here and just show you very briefly what it looks like to get started. So here's a project, and down here in my interface, you're going to see ReEntry. And it's going to guide you through 3 steps: sending a survey, and adding data. And so I won't take you any further just this second, but I did want to say it's just that easy, and it's just that free.
Wow, that really looked great. I could do that.
Really not that scary. And
Yeah.
once you're in here, the rest of your sustainability journey, we can do that too.
Okay. So I don't see any questions coming in, surprisingly. I thought we would have quite a bit, but I think people are probably just full of all this new information and ready to go to the site to check it out. So with no questions coming in, I think that probably concludes our presentation today. Again, I'm so glad that you were able to join us, Chris. This was a great presentation. I know it was very valuable to all the people here. Oh, we do have a question. This happens to me all the time. Any recommendations for air quality sensors and approximate cost to expect?
Yeah,
So
that's a great question. Go ahead.
Well, I was just going to say, I know you touched on some free sensors that you could get very inexpensive, but I guess, what is inexpensive? And
yeah, what is inexpensive, right? So that's a great question. I would expect that, so we don't sell sensors directly, so I can give you a gestalt about what it costs to get started. Generally speaking, in terms of what we're looking at, we're talking about a sensor that reads CO2, TVOC, particulate matter, and relative humidity. So that's pretty much most mid-range, most sensors are going to do that. There are probably at least a dozen viable sort of commercial type sensors that are in the ballpark of, say, less than $1,000, maybe $500 for 1, 2, maybe 3 units. So depending on how large an area, so just broad brush. I mean, these are broad brush. So less than $1,000, you can get it. You can get a hold of a system that will give you at least one, if not multiple, sensor points that you should expect to be able to measure all of those things, which I just said. You can expect them to communicate via Wi-Fi or something like that. You can expect them to provide a decent job of measuring all this stuff on the short term. So there are vendors. We obviously work with Arbenco. There are vendors named Kytera or Wind are some of the other folks out there. A lot of your building automation system providers, if you, for instance, have a contract with a Siemens or a Schneider, they may also have solutions that are integrated with your building automation system. Some of our folks are doing that as well. So I think the thing to know is there are options. And some of them are listed on our web page as partners. Others are out there if you're looking at low-cost commercial sensors. And so I Wish I could give you like a specific like consumer reports guide to these things. I can tell you that the Lawrence Berkeley National Laboratory in California has done a survey, basically a consumer report style survey of low-cost sensors. And I would encourage you to check out LBNL and low-cost sensor comparison as a place to go to look for that. My general feeling, just one last comment on sensors, is I think people worry a lot about sensor accuracy, and that is a concern. However, I think when it comes to managing COVID in the real world, the difference between poorly performing spaces and good places is big enough that you can detect it even with fairly inexpensive sensors. What I'm trying to say is the differences aren't subtle. The badly ventilated places that have 1,000, 1,500, 2,000 ppm of CO2 are quite different from those that are at 4 or 500. So you don't need super sophisticated tools. You're looking at relative humidity. That's inexpensive. And not to worry too much, VOC is a tough measurement, and so is PM. But just wanted to say that you don't, there are options. There is some guidance from Lawrence Berkeley National Lab, and don't worry too much about accuracy. It's important, but don't get tied up in it. If I could offer that.
Well, that's wonderful. Very, very good advice. All right. Well, I think I'm safe to say that I think that wraps it up for today. I don't see any more questions coming in. And if you do have more questions, yeah, Chris will be following up, and you'll have his contact information so you can send him something. Okay, we have one more question. In your experience with COVID, can you see future trends for office planning? Very good question.
Yeah, that's a great question. That is kind of the $64,000 question. I think that I think the office environment is incredibly uncertain. Let me tell you what I know. I mean, I can crystal ball with everybody to say, hey, the era of the open plan office is in trouble, and that we may be going back to a more enclosed environment. I'm not sure I'm ready to cast judgment on that as much. I think that there's a lot of factors one way or the other. What do I know? I do know from the ARC perspective that one of the things that's changed is a greater expectation for transparency about the performance of the workplace. A year ago, before COVID, we dealt with large landlords all across the country, and it was really typical when we pushed on them to do an occupant survey or to measure the air. We got, oh, can we get a waiver? Do we really have to do that? Can we do that next year? Can we put that off for a couple of years? Okay, that's not what we get today. We get, oh, I understand why that's relevant, and I got to get on that. And the tone has gone from, can I have a waiver, to, okay, I understand that I'm going to have to do this in more places more often. So I think the one thing, I think we could have a big conversation, maybe a glass of wine, and talk about the future of the office. But I do think that regardless of what the form of the office is, the expectation for real world performance information about the air, the light, the acoustics, and I think it's not just COVID, it's going to go into other aspects, is rising and rising quickly. And I think it would be a safe thing to say that, I don't feel like I'm going too far out there to say we're going to see a pattern that maybe looks a bit like 2007 on steroids, where we're going to see a flight to quality. We're probably going to use less office space, and our expectations for what we have will be higher. And I think going beyond that gets pretty tricky in my view, but I think those are pretty safe crystal ball opportunities.
Okay, I'd have to say I'd take that bet. I think that's a probable. I see where you're going with that. So, okay, I don't seem to have any other questions coming in. If you do have a question, he will be following up. You'll have his contact information. Can certainly always chat with him via email. Again, Chris, thank you so much for your time this afternoon.
Great. Thank you for the opportunity.
Greatly
Thanks,
appreciate
Mary.
it.
Very nice to. I'm looking forward to following up. Take care. Thanks,
All
guys.
right. Thank you, everybody. Bye-bye.